And back now, a Sunday House call. You know that some people go to the doctor for a checkup once a year. But a new study suggests a different approach, claiming that there actually is little benefit to the annual exam on healthy people. Dr. Siegel, I know someone, you go every 6 months and they feel better doing that. What about this once a year?
Well, Eric, first I want to burst a bubble on where this comes from. It's something called the Cochrane Library, and we've talked about it here before on the show. There's a PhD student over in Denmark that looked at 183,000 patients, looking over many decades to see whether the yearly physical actually benefited them or not. And they concluded it didn't. It didn't make them less worried. It didn't make them go to the doctor more. Overall, it didn't actually help their long-term health or death rates. So that's good information, but I want to burst a bubble on this because in daily practice, there are other things here that are important. Those studies didn't look at smoking. They didn't look at the fact that you actually lower your cholesterol and your blood pressure by going at least once a year to the doctor. I don't do yearly physicals in my practice. I follow patients regularly, but the yearly physical may help me to bring somebody back in that I haven't seen all year. So that's how I look at it. If I haven't seen someone and they're suffering from regular medical health problems, I want to be able to help them. If I'm seeing them regularly, they don't need the yearly physical. If I'm following a diabetic, I may see them every 3 or 4 months. I check their blood sugar. I'll do an EKG along the way. But what about things like vaccines? What about things like cholesterol testing? What about things like blood pressure testing? Screening tests for smokers? You have to see a patient at least once a year. So I can spread it out over the year, but if I haven't seen the patient, I want the physical.
Dr. Samadi, I look at it like you're taking your car in. Once a year at least. I want to go in at least once a year because how do you know you're going to get cancer or a tumor or something? That way it'll discover
I'm waiting for him to burst the bubble. Is it burst already?
It didn't really burst.
Didn't burst yet. Okay.
But you should see your doctor regularly.
The truth is, Jamie, you're absolutely right. Look, we're living longer and longer because the medical doctors are taking care of the heart issues. But I've been a big advocate of prevention. I think it's excellent to get a baseline physical exam at the early age, so you have that for yourself. Now, if you're absolutely healthy and there are no medical issues, it's okay to skip a few years and to go to every 4 years. We're not talking about screening. We're just talking about physical exam. That includes EKGs, all the blood tests, etc. If you're fine, you don't need to do it every year, so you go to every 4 or 5 years. On the other hand, when it comes to screening, we're talking about mammograms, colonoscopy, PSA screening, and others. You should do it on a regular basis and follow your doctor's advice, and that's really, really important.
I just don't want something to pop up, and I'm sure people out there watching don't want pancreatic cancer or something.
And as doctors, sometimes we tend to be more overdoing it and be a little more overcautious. So you got to take case by case and patient by patient.
There's enough things for us to be checking so that we have to be checking patients regularly. From the PSA to the colonoscopy to the mammogram to vaccines, all of these things require regular follow-up.
Okay. And since it's October, let's mention self-exam for breast cancer as well.